Good morning.
What's up?
Honestly, Dr. Ashley and I were talking about some health and life struggles that we have both been having lately. And so I thought we would just talk about some of those.
That's funny because my first topic written down. So those that don't know us, we tend to like map out the episodes and then go off the cuff to some degree. Topic number one: Ashley is drowning and lives on the struggle bus.
Yeah. Yep.
Yeah, yeah.
Let's talk about it. What's going on?
Well, it's one of those things where it's not all negative. So it's funny because this is all born out of very positive things. But those that have been listening and along the journey and or have us on social media will know that in the last year, me a little bit more recently have gone out on our own, started our own businesses. And that's very exciting and definitely where you and I are supposed to be in our lives, undoubtedly.
Yeah.
Very excited about all the things that I've started, but I would be lying if I didn't tell you it's also so overwhelming. I basically left my business overnight. I left the practice that I was at. Well, left is not the right term, but I stopped practicing at my previous location and overnight started this. And
And it wasn't because you wanted to dip out and peace out.
I was towing how I wanted to put that.
Yeah. And that's all we'll say about that.
The facts
Contractually.
the facts are that Ashley did start a new practice overnight.
Yes. Those are the
not
facts.
her choice.
Those are the facts.
But I've been operating in one capacity for the last 8 years, right? Like I've operated out of other people's clinics. I have had my own programs, but this is all completely new systems. It's a new location, dealing with landlords. I've been organizing, well, I have a partner, but we have been organizing construction, dealing with like every utility company, you name it. And like, I just can't keep all of the balls in the air. Like my boyfriend jokes about it. He comes over to my house and he's like, Ashley, like what's happening in your yard?
Yeah.
I'm like, listen, I don't want to effing talk about it. I haven't cut the grass in 2 months, I bet you. You 2 months, most of the summer. I have weeds that are 2 feet tall, and I have literally been closing the blinds so that I don't have to deal with it, because the fact of the matter is I don't have time to do it all. So like I get to make a choice each day that I wake up. It's like, okay, am I going to have prepped food for the day, and am I going to eat regularly? Am I going to exercise? Am I going to take my son to the park? Or am I going to cut the grass and weed the backyard, right?
Yeah.
When I tell you, I'm actually not kidding. I constantly have approximately 6 loads of laundry to fold at any given time in my basement. And, there's just not much I'm going to do about it at this point in time. Like, I'm at the part in my business where, things are in a lot of ways going better than I could have imagined, but not quite at the point where I can outsource a lot of things. I used to have a cleaner. When I knew that this was all up the chute, I put a pause on that. And like, do I desperately need a cleaner at my house? You bet. Should I hire somebody to like cut my lawn? Probably. Should I have more people coaching some of my classes? Yeah, because I'm working 8 to 8 pretty well every day, but you don't get to have those overnight changes. Like, Rome is not built overnight, but it's like hard at the same time. Like, I'm glad I'm grinding for me now. You and I talked about that this morning. Like, I could be doing this for somebody else's business, and I have for many years. At least I'm doing it for me now, but like, holy shit, is it not easy?
Yeah. And there's this concept that I was in a business conference last week, the end of last week, and there's this concept that we actually talked about in this conference, and it's called the dip. And we were actually talking about it in business, but it applies to health as well. And the dip is this concept. Now, sorry if I butcher it. It's a Seth Godin term. So if you like Seth Godin, like, look, he's great. But essentially what it is it's the time where you've put in all the work and you've put in all your time and all your energy, and now you've created the thing. And now the dip is the place where it's really easy to like get out, to quit, to stop, because you're like, wow, this is really friggin' hard. And like,
Yep.
this is a lot and I'm overwhelmed. And this can happen in your health journey as well, right?
For
You
sure.
get in the dip, you're like, but I've put in, this is where I get with, um, and I guess I haven't been super, transparent, like publicly, but I've been very open with Ashley and friends and family about, how I need to lose weight and like how I am the type of person where I'll work out and I will commit. And then 6 weeks in, still don't see the scale change. It's
Yeah.
really easy to stop.
Yeah.
Mad,
So
rattled.
easy. So
Right.
easy.
And this is the dip, right? This is where you sink or swim. This is where it creates like, are we doing this or not? And the concept of the dip is like is is separating the people who are going to persevere from the people who just aren't. And this can happen in health, this can happen in life, this can happen in business. But I think also like I think people can really relate to where you're at right now because you're also a single mom. So like I'm thinking about all these things and I'm thinking in my head like I've quite literally never even turned on a lawnmower. So I wouldn't even like my weeds would be growing, but it wouldn't even be if I just wouldn't know what to do. So, being a single mom and like having to mow your own lawn, right now we have a alleged mouse problem in our garage.
Legend.
And I say alleged
Have
because
you even seen
I
it?
haven't caught one. Okay, I need to unpack a couple things right now.
Okay.
We think we have mice in my garage, okay? And there's at the back of my garage, I don't know why, but my home in my garage is where our electrical is. It's all in the garage, okay? I don't know why. But
Okay.
in the garage there's our electrical panel and then there's a hole in the back of the drywall, very poorly planned hole that the cable I guess they've run a cable through there and that's like how my internet is connected. So there's like a hole probably this big. If you're not watching, it's like, I don't know, what, 2 inches by two
Tennis
inches?
ball? Yeah,
Yeah,
tennis ball size?
yeah, tennis ball size hole in my drywall that there's like cords going through. So
So like
clearly,
squirrels could fit in there too.
right. If I'm a mouse, guess where I'm living? In that
Right.
hole in the warmth of the
For
home.
sure I am.
Okay.
Where there's garbage that could feed me.
Right. So what started happening first was my maggot problem. So
Yes.
what had happened? The straw that broke the camel's back was
The camel
my
was
kids and
Laura. Go on.
the camel was me. I freaked out. So we walked out into the garage. We do this every morning. Me and the kids. I mean, me and the two children. We
Right.
walk out through the garage because I throw the kids and all their stuff in the wagon and we walk to school. Okay. That's what we do in the morning. And so we do this every morning. So I know that it happened overnight because one morning we go in and Leo goes into the garage first and he goes, Mommy, there's bugs everywhere. And I just thought, like, okay, Leo, like what
Right.
ants, whatever.
Flies, whatever.
Yeah, I was like, oh, Leo, it's fine. I get out to the garage, and when I tell you, army of maggots, maggots everywhere, like crawling along. I'm like, oh my God, I'm going to puke. Do you know what I did? I literally got back home. I had to work a lot that day. I was like, I don't have time for this. I got my bleach spray. I sprayed a couple like patches of them, and I closed the garage door.
That'll do it. That'll do it.
I went inside, and I pretended it wasn't part of my reality. Okay. So that's what happened first. And I was like, first of all, how did they get here? I've since learned that flies birth may. I don't know. I don't know what happened.
That's correct.
So that happened first. And I was like, okay. Again, root cause thinking. I'm like, but how? Like, what happened? Because obviously something ripped my garbage. So, backtracking, we're like, okay, we for sure have mice. So then we put out traps, okay, mouse traps. And my husband puts out mouse traps, and he's told that peanut butter is like a good thing to put on mouse traps, which
Okay, I buy it.
Okay.
You were gonna put cheese, weren't you? A little squeaker of cheese.
We didn't catch one. We didn't catch one mouse. And he's like, I used peanut butter, and I'm looking, and I'm just thinking, like, we don't have peanut butter. Like, we actually buy almond butter. Okay, we don't really have peanut butter. So I'm like, did you use almond butter? He's like, yeah.
He used your expensive organic almond butter from Costco.
And also, mice don't like almond butter. I've come to learn.
Did you Google it? I didn't know that.
No, I'm just based on my experience. They don't like almond butter.
Based off of the lack of getting them in the
I've
trap.
caught 0 mice so far. Okay, so then I was like, all right, he had them set up around the edge of the garage, and I'm like, why did you put them along? Why wouldn't you put them by the hole? He's like, well, mice are blind, so they run along the walls. I said, I think that's a song. Like, I
No, they're
don't think
not blind. Oh my god.
Three Blind Mice. It's the childhood song. I said, that's not factual. He's like, I've always thought they were blind. I'm like, ah!
Oh my god, Luch. The way I'm going to make fun of you the next time I see you.
It gets better. So then we're looking at where the hole is. And I'm like, I think they go back in that hole. He's like, there's no way. So the hole is probably like a couple inches off the ground. He's like, there's no way it can get into the hole. I'm like, what do you mean? They just jump.
For
He's
sure
like,
it can.
mice can't jump.
Okay, so officially, we cannot let Italian men deal with mice in a garage.
So,
oh my god.
So literally, I'm like, no, they can jump. And he's like, well, why have they, if mice can jump and they're not blind and they can rip open our garbage and they can pull the garbage from one end of the garage to the other end, why is there no superheroes based on mice?
Is there not a Mighty Mouse? I'm so confused.
Okay, maybe. That would make sense. That checks. Mighty Mouse checks.
Hold on a second. This is very important and we need to find this out live.
Okay.
Does Luch listen to the podcast?
No.
Okay, so for his surprise birthday party, I want to dress up as a mouse with like a blinder stick and say nothing. I want to say nothing. I just want to show up in a mouse costume. It's Halloween. It's out there. I just have to find it.
Can I just be clear with everyone? This is not a Halloween surprise party. So Ashley would be, in fact, the only person in costume.
Will be me.
Oh my god. Okay, so anyways, we haven't caught a mouse. We haven't caught one mouse. We've since put cheese because I've actually heard that they like cheese. And I can confirm a couple things. They like my Nespresso pods. Number 1. They like my hummus. Number 2. Okay, so those are the things that are
I think the espresso pods give them a little bit of a challenge.
Well, Luch was like, they're all hopped up on caffeine. Obviously, they can pull a paper plate from one end to the other. So anyways, we're all struggling. We're all on the struggle bus. I have mice. Ashley has
we tested, Deneen and I tested our business partnership yesterday because we built 3 very large pieces of furniture and we're not divorced. So if we have to circle back, I'm drowning, but I think I'm doing it with a pretty cool team. So, you know, we're going to...
We just hired admin, so that's a win.
And we've hired admin. Yeah. Exactly. So we're getting there, right?
Yeah. Yep.
The other topic I kind of had slotted for today, and it's a brief one and more generic, if you will. I think it could pertain to a lot of different things, maybe even what you're going to talk about today. But my other topic is, like, as women, how long do we have to wait before we get anybody's attention or before we get our symptoms addressed? Mm-hmm. I feel like this is a huge theme in my practice, and I feel like unless, somebody is actually hemorrhaging each month or their pelvic organs are dragging behind them on the sidewalk, nobody really wants to help them.
Yep.
And I have a very specific case this way, and I've seen it in my practice a lot, actually, and it's specific to pelvic organ prolapse. So for those that don't know this, we can find ourselves with a condition where our pelvic organs, namely our bladder and our rectum, they're the most common ones, but also our cervix can prolapse outside of the vaginal opening. And we broadly call that pelvic organ prolapse. Now, there's certain people or groups that are more susceptible to this after birth when the pelvic floor has sustained trauma, just like any other muscle tear. It becomes more likely and hormone shifts for those organs to descend into the vaginal opening. Also during menopause, similarly, hormones affect our tissues and our strength of those tissues, and it becomes more susceptible that way. I don't know if anybody knows, of an aunt or their mom or their grandmother that had to have a bladder mesh surgery. that is a surgical correction to keep their bladder further up in their pelvic cavity such that it's not prolapsing. That's why that surgery exists. Now, in the last several years, they've been around for a long time, but we can get something called a pessary. And the pessary is effective. The way I explain it, it's like an orthotic device for the pelvic organs, right? So you can take it in, take it out. It stays in to basically hold those organs up such that people have more comfort during day-to-day tasks. So what we were talking about this morning was a patient.
Sorry, I have a little bit more.
Okay, ask questions.
Number one is it a permanent device? Do you take it in and out?
You take it in and out. You take it out and clean it and everything like that. Like picture, I mean, I know it's not your favorite, but like a tampon or a menstrual disc that can come in and out.
And are we taking it out daily?
Yes. Yeah, you want to take it out and clean it and things of that nature. And most people I know don't like sleep with it in. You wear it typically during more symptomatic times. So let's say you're all good in the hood except for if you run and then you get, that heaviness, that dragging feeling in the vagina, then you would put it in before you go for a run. And then lots of people would take it out afterwards. So it can be used as a device to manage symptoms. Some people wear it, if their symptoms are severe, it's very individualized, right? So if somebody has a job where they're on their feet all day, let's say they're in construction, right? And they find that walking around constantly on hard floors, that they get that heaviness setting in their perineum, then they might put it in for their work day.
And so is this fixing anything, or is this supposed to be complemented with other therapies?
Complemented. It doesn't do it. It's merely a device to help with symptoms. Just like if you had neck pain and you slapped a TENS unit or a Dr. Hose unit on, that's not fixing anything. It can be really helpful symptomatic relief. Or same thing as an orthotic on the most part. The orthotic will temporarily, in your shoe, change your anatomy and support the bones and structures of the feet, but it's not getting in there and waving the magic wand and actually building you a better arch, right? It's like a temporary orthotic device.
All right, go on.
Go on. Okay, now that we have that answered.
Yeah.
So anyways, this particular patient that we were talking about had gone to, their family medical doctor and multiple pelvic health physios, and just kind of been like, I want a pessary. And everybody was like, no, not yet. Keep doing, pelvic floor physiotherapy and see where you land. And she was like, well, I'm doing all of the things and, I want one. And she's effectively been talked out of it by.
What are the negatives? What are the risks?
That is a great question. And that's something that we were talking about today. And I was like, well, from my last sweep of the literature, there's really no negatives. It's not, it's not pokey. I haven't seen any cases of perforation or anything like that. Yeah. But if it's put in correctly and it's supporting the organs, it doesn't really go anywhere. You can take it in and out as long as you are hygienic about it all. The biggest risk is that of any type of infection, right? And mostly urinary tract, not that kind of thing. But there is really no risks.
You know what the one thing I think about automatically when you tell me exactly what this device is?
What?
I think about biofilms, and I think about microbiome perturbations long term.
Okay, that's something I didn't think about actually.
Yeah, interesting. Yeah. I mean, cleaning it properly, but I think also some digestive work is probably warranted in that scenario. But yes, anyways, go on. There's nothing deadly that's going to be happening.
No. There's nothing nefarious that's going to happen, right? And then, it's something that we can do. You already nailed it. It's something that we do in tandem with other things. Now, we certainly wouldn't tell this individual, do not participate in your pelvic floor rehab to whatever, strengthen the muscles, increase their endurance, build yourself up to those higher vertical impact forces and loads. Yep. It's not a be-all, end-all. You would use it in conjunction with other things. But my head went a different way. I wonder if, in this scenario, if a lot of pelvic floor physios see this as a failure in the treatment plan. their work or their rehab or their prescribed program has failed the patient, and therefore it's something that they're not willing to recommend at that time. Like, I think there's still the stereotype of like you have to do all the hard work and you have to do the rehab and that'll fix all the things, but unfortunately with a lot of the cases that you and I work with respectively, a lot of them are quite complicated, and I know you and I are getting a lot of patients that have already seen a multitude of other therapists and nobody has quote unquote figured it out. And I think that humans are complicated, and unfortunately there's some people that don't respond to sort of the traditional protocols or
Well,
the approaches of care.
and is a medical doctor recommending this, or is a physio recommending this?
You both. So as a medical doctor, I think both need additional education. Like, most family doctors I know of aren't well versed in pessaries. They certainly don't do pessary fittings. I'm sure there's some of them out there. I think this would be more of like an OBGYN
Okay.
specialist situation. And then there's certain pelvic floor physios that can take additional continuing education in order to be able to recommend fit and make sure that individuals are wearing pessaries appropriately, but not everybody does it.
Well, and in my world, I think I could relate this to somebody who, despite all of our things, cannot lose weight, and we end up going with a GLP-1, like an Ozempic,
Right.
right? Like when we've given it like everything,
Yeah.
at some point, we have to say, what else is there? Like, we have to take advantage of the medical system as it is, and take advantage of what pieces we can put into play for that.
100%. And I think especially when the risks are quite low and
Yeah.
the patient is really advocating for it and they want to try it, and it's something that doesn't interfere with other interventions, I feel like that's something that's worth entertaining, right? Like, I just feel like we shouldn't have to, like I said, have our pelvic organs outside of our bodies before anybody's willing to entertain it. I've also had patients that I've sent back to their OBGYN to discuss this option, because it's
Yeah.
not the scope of my practice to fit, recommend it, do all the things. And they were immediately given a consult for surgery. And I was like, did you guys talk about the pessary? And they're like, they skipped right over it. They wanted to go right to surgery. And I was like, but why though? Why?
Yeah.
That's not what the clinical guidelines suggest. We have this low risk option. Why is nobody entertaining this?
I wonder if it's, and this isn't a good reason for that, but I wonder if it has to do with the inability to have follow up. Like the inability to, like, I know, for example, again, back in my world, because I
Right.
don't do these, but I know with vitamin D, like someone's vitamin D, their medical doctor could test it and it's like dirt low, bottom of the barrel, and they're like, just take 1 drop a day. And in my opinion, I'm like, I can't find a reason that they would recommend such a low non-therapeutic dose, other than if they're like, well, I'm probably never going to be able to see this patient again. I have too many patients. I probably can't follow up, and I want to make sure that they're not going to overdose on my watch.
Right. But then at that point, I think I'm a little bit confused as to why you wouldn't set a follow up for this. Because in my opinion,
I don't
that's a
know.
really excellent use for telemedicine, right?
Yeah.
Because you might not have to see the individual, but you may choose to send them, excuse me, a requisition for additional blood work down the line, and also check in with them symptomatically. How are your energy levels? How are you feeling overall, right? Like, I don't know that you even need to see that person necessarily in person, be like, hey, now's time that we want to do follow-up blood work to see where your levels are at. Like, that's pretty simple, no?
Well, I think the problem is, like, we get in this weird, and this is why kind of you and I do what we do, because one of our biggest goals, specifically in doing this podcast, is actually just to educate people so that they know how to make choices for their health. Because
Right.
I think there's such a stigma that becomes of. There's a stigma as a result of people not feeling like they're listened to, they're not taken seriously, their symptoms are ignored, and so they're like, I have to advocate for myself. And then we try to figure out, well, when should we really advocate and when should we not, right? Like, when do we
Right.
trust that that's not the path to go? Like, for example, hysterectomies. Like, is the goal that we're just supposed to push until they just take our uterus out? You and I have chatted about this.
Right.
Probably not. But as
Probably
it
not.
pertains to a pessary, yeah, we should be advocating as far as we know. Like there's really, again, it's a risk benefit conversation on what's the best next step for you,
Right.
right?
Totally.
So
Totally.
yeah, it's wild. I've never actually heard of those, so I think that's
Yeah,
something.
and I mean, it would be interesting if the conversation led to like even what you had mentioned with like biofilms affecting people's digestion in a negative way. Like I can pretty much promise you, I haven't looked. I doubt there's very much long term data at this point.
Yeah.
So, like, are there risks potentially? For sure. I think you're foolish if you don't acknowledge that there's potential long term risks to anything, even if you don't know what they are. But I think that needs to be a part of that balanced conversation. And as far as I'm seeing, people are skipping over that step and just being like, yeah, like, go have surgery.
Yeah, totally. Totally. Yeah, and I think these are really important conversations that need to continue to be had. When we look at, switching gears a little bit, I think one of the things I want to highlight very briefly is bone health in perimenopause and postmenopause, because I think this is something, again, that I think a lot of people worry about this, but
Yep.
it's not like a sexy thing that we see on the internet, right? Like
No.
it's not, everybody wants to say like balance your hormones, lose
But you know
weight.
what? Fractures aren't sexy either. So,
No, fractures
no.
aren't sexy. And I actually want to, again, when we're looking at the bigger picture, looking at hormone therapy, I think is really something that we need to circle back on. I think a lot of people became really scared of hormone therapy, and they kind of never looked back. And when it comes down to it, when we're looking at going on hormone therapy, we need to actually assess what are your risk factors, like should you be on it. But one of the things hormone therapy does really well is it actually increases your bones, your bone mineral content, your bone mineral density, and so that's actually such a cool therapy that we can intervene with to help with your bones at this period of time. And then also, I'm sure Dr. Ashley, you're familiar with the FRAX score, but for people
Yeah.
who aren't, essentially you can just Google FRAX. It's the fracture risk assessment tool. And it's just a short questionnaire. I'm on it right now. There are effectively 12 questions. You may or may not have the answer. Like if you've never had a DEXA, then you don't have your
Right.
BMD. That's fine. You don't actually have to answer that question. It asks about your age, your date of birth, whether you're male or female, your weight, your height, previous fracture, current smoking, like some medication use, alcohol use, and it will determine what your fracture risk is. And so that's actually part of what we look at when we're debating whether or not hormone therapy is a good, fit for you. Now, there's
Yeah.
other things we can do. We know that effectively exercise and strength training is going to support healthy bones, but hormone therapy is something we can also do. And I came across this study that said, let me just pull it up, but it was about the microbiome, which I love, and bone health. And again, we know that working on whole body health is good for bone health. Let me just pull it up. I just had it. Now I have way too many tabs open,
Oh, that's my
and
life.
here we are. But stay tuned. Okay. So I was looking at a couple things. Number one was the effect of isoflavone interventions on bone metabolism. So for those who don't know, isoflavones is found in soy. So again, it was an umbrella review which assessed existing meta-analysis evidence on the effect of isoflavone on bone metabolism in perimenopausal and postmenopausal women. And so what they found that is that isoflavone interventions have the potential to improve BMD at different bone sites, including lumbar spine, femoral neck, and total hip in perimenopausal and postmenopausal women. And this actually may be considered a complementary option in bone loss. And so again, I love to recommend, even for hot flashes, I like to recommend soy, because it's a really easy intervention. Now, when it comes to soy tends to be sprayed with a lot of pesticides
Right.
and tends to be genetically modified. So I always say if you're going to choose this as a daily intervention, I'd prefer it be non-GMO organic, just so that
Right.
we're not disrupting hormones further. But that actually is pretty cool.
What
Oh,
are
I
some of
found
the sources you would recommend for somebody? Like, I'm assuming you're not like, hey, go get yourself some soy milk, or maybe you are. Actually, I'm just curious.
Yeah, no, I actually would. So
Oh, okay.
you can actually get an isoflavone like supplement, right? But again, depending on, the load of all the things somebody's taking, it's like, what if they're already on 5 or 6 things? Do I also want to add a soy supplement? Or
Right.
can we just say have like, a cup of soy milk every day?
Right.
From a hot flash perspective. Now, I didn't actually look at the dosing of the isoflavones for bone. That might
Okay.
change the recommendation from a
Yeah.
therapeutic perspective. And again, this is the conversation I like to have with patients is, it might actually just be a complementary thing. Maybe it's just again, soy is a great source of protein, right?
Right.
And when we look at the protein quality, we actually see it be very similar to animal protein from its like quality. It actually, not a lot of plant-based proteins stand up against animal-based proteins. So, it's actually shown to be good from that perspective as well. But I need to look in the dosing to see if it would make sense to also apply that
Yeah,
same.
that would be interesting.
Yeah, I will TBD, guys.
TBD.
And the study that I was looking at was published August 31st. And it was published in the Critical Reviews in Food and Science Nutrition, and it's called Gut Microbiome Targeted Therapies and Bone Health Across the Lifespan. And what I thought was cool, so again, it wasn't consistent across the board, but they found that essentially when they did probiotics, prebiotics, and symbiotics, it could actually attenuate bone loss across the lifespan, which just really, like, for me, drove home the point that we know we need to be working on the microbiome and gut health as part of overall health, bone health, cardiovascular health, metabolic health, hormone health. We need to be looking at the gut because we know that, again, it's not, take a probiotic for your bone. It's
Right.
that the presence of these positive bugs, the presence of the food for these bugs is actually really beneficial for bone health.
I think that's really cool.
Yeah. So, to close out on a no, this episode had random turns, but hopefully it can be helpful
Kidding.
for everyone.
Yeah.
Um, and yeah, if you guys have questions, let us know. I have my upcoming 5-day perimenopause challenge. So if you're interested in learning more about metabolism, why metabolism changes and everything throughout this lifetime, throughout this time in life, I mean, we're starting Monday, the 23rd.
Love
So
that.
you can sign up for free. And yeah, if you have questions, message us on Instagram.
Yeah, we would love that. It also helps drive our content. So anything you guys want to hear about, anything you want to talk about, reach out to us.
Yeah. All right. Awesome. We'll see you guys later.
Bye.
Bye.